renowned doctors to address us on issues related to women's health. And we are grateful to our Honorary Secretary, Dr. Pathak, for instituting this annual lecture series. This morning, it is my pleasure to introduce Dr. Kayan Siodia, who has completed his MBBS and post-graduation in internal medicine. After that, Dr. Siodia completed a super specialty degree in critical care medicine, and he has worked as an intensivist in the ICU at Nanavati Hospital for 3 years. Following which, he also completed another super specialty degree in cardiology. Doctor, we have lost count of how many degrees and qualifications you have. To add to this, he has fellowships in complex interventions, which include complex coronary angioplasties, CTO, and image-guided plasties. Dr. Siodia has achievement of a rare fellowship with structural heart disease and specializes in procedures like TAVI and clips, which entail replacing the valve without opening the chest. He is consultant at lead hospitals like PD Hinduja Hospital, Raheja Hospital, and Wockhardt Hospital, and he is certified by American Heart Association to teach basic and advanced life support systems. And recently he was awarded another degree to independently put impellers, which are artificial hearts. For most of us, including me, these are all relatively unknown terms, and I'm sure in the course of the lecture, Dr. Siodia is going to educate us on what we need to know about modern technology as far as cardiac care is concerned. Interesting tidbits from Google, which Dr. Siodia did not include in his resume, is that while a student, he has won prizes in sports, in elocution, and he has a black belt in karate. He's also a trained pilot. So in fact, I think we should ask Siodia what he does not do. But in a quote, in an interview, he has stated that medicine is a tedious process and there are no shortcuts, and I think this is a message to our students. There are no shortcuts to success except hard work. He also acknowledges that above us there is the Almighty, and he mentions in the same interview, without his blessings nothing is possible. And he says one of his teachers had rightly said, we treat, he cures. And we are really looking forward to what Dr. Siodia has to say on this important topic about empowering hearts, because we always talk about women's hearts in another context. Okay. So thank you very much, sir, and we're really looking forward to your presentation.
Mr. President, Mr. Chairman, members of the staff, the lovely audience, thank you for an overwhelming and gratitude-filled welcome. It was really overwhelming. Thank you so much. Really appreciate it. Okay. So what I'm going to talk about today is something you all know. You must be hearing this at least twice a year, but hardly anybody puts into practice. I am going to touch upon what exactly are the cardiac conditions which are an issue today. How is it different in men? How is it different in women? To peak the topic, I am also going to speak on newer advances in cardiology. So as I specialize in that, I'm going to actually show you live cases where we replace valves without opening the chest. Hardly people know about it. So I'm going to actually show you live cases also, just for the interest, that these things also happen. So what is heart diseases actually? So it's a general term. I have 30 minutes, so I have to be on the time, so that's all. So what is heart disease? It's actually a general term which encompasses the entire spectrum. So what we know and what we generally talk about is only heart attacks. But remember one thing, heart is a muscle. It's a living thing which beats at least 70 times a minute continuously till the end of life. it itself needs blood supply. It's a muscle, it's a living tissue, so it needs its own blood supply. So, having said that, I'm just going to take it forward and come back to this topic a little later. So, heart diseases encompasses a general term. It is also known as cardiovascular diseases. It includes not only the heart, but also the blood vessels. So how does the blood flow to the entire body? The heart pumps. But how does it flow to your feet? How does it flow to your arms, your liver, kidney? How? So it's a network of pipelines, if I may add, in very crass terminology, that takes the blood from the heart to the other vital organs. The most important being coronary heart disease. So coronaries, when I say coronaries, the terminology is the blood supply to the heart itself. Now there is something very, very interesting about the blood supply to the heart. Very interesting. So as we know, when the heart contracts, blood pushes out and goes to the other organs, correct? So it's only during contraction of the heart that other organs will receive blood supply. But the heart itself will receive blood supply only when it is relaxed. So that way, this organ actually stands out in a very, very big way. So heart attacks actually mean coronary artery disease. The vessels which supply the heart get blocked. So that's what it means. This is a beautiful diagram and not the heart shape. So it's nearly the same, but in three-dimensional it looks like this. So as you know, as you see the RCA, I don't have a pointer here, but you see the RCA on the left side? Okay, you see this RCA? Your left circumflex, obtuse marginal and LAD. These are the main arteries that supply blood to the heart. Okay, so just a brief overview of what things look like from my perspective. So again, there are a few terms, most of them misunderstood. Angina, when you will see that people say, I have angina, that means chest pain from the lack of blood supply. What are heart attacks? When this blood supply is completely occluded, the tissue dies. It's living tissue, right? That dies. That causes this. What is heart failure? It is a terminology used when the heart cannot pump enough blood to other organs. Now, again, a terminology which has very recently come into picture. Heart doesn't have the only function of contracting. Normal. But they have something called microvascular disease, which is often misunderstood. Stress tests. People time and again keep coming to me that my stress test is negative, stress test is positive. Stress test is a very sensitive test. If it is negative, the chances of you having a heart problem is very less. But if it is positive, does not necessarily mean you have a heart disease. Please, I'm going to push on this point again and again because I see time and again 30 and 40-year-old ladies undergoing unnecessary angiograms just because their stress test is borderline positive, which is not okay. Lifestyle. We have started, Asians especially have started imitating the Western population. They are changing. They are becoming more Indians than we were. But we are becoming more Western than they are. Smoking has gone up by 33.67% in Indian women. Drug intake has increased by 12.5% in Indian women. And this is the root cause which is not spoken about, which actually causes issues in women. There are non-modifiable risk factors like pregnancy, hormonal changes, which they go throughout their life cycle. So that is non-modifiable. So as you can see here, this is what it actually looks like. It is here. It's a healthy artery. Can you see this yellow thing? That's your cholesterol being deposited. It keeps on depositing as the age progresses, and then there is nearly complete occlusion, which causes heart attacks. Now this terminology is very, very interesting. It is called SCAD, spontaneous coronary artery dissection, which is very common only seen in women, especially younger women with heart attacks. The artery spontaneously closes down. There is a dissection in the artery spontaneously. So we did a little research. There is a multi-standard trial which showed that this occurs somewhere down the line in women who only smoke. So smoking is a very, very big factor, especially where scads are concerned. This statement was made in the Indian Heart Journal, 14 June 2022, Volume 2. I was very upset. Why do women get a less chance for rehabilitation after a heart attack than men? And there is no subgroup analysis to actually tell you why that happened, but it is something that needs to be addressed in a very, very big way. And especially women of South Asian origin, as I said, are more prone to diabetes, blood pressure, heart issues. So the ECG may show changes of an acute heart attack. You do an angio and it's absolutely normal. So it's called a Takotsubo disease. So the heart looks like an octopus. That's why Takotsubo is octopus. So that is what it is called, broken heart disease. So when you have a breakup or something and you're really stressed, variant anginas. So anginas generally you will get when you're walking, you get chest pain, there's the classical Levine sign where you actually put a fist and you're bending down, you have a lot of chest pain. In ladies we see that it's a little different. They can have it during their sleep. It can be a pinprick sensation, but generally occurs without exertion or just breathlessness. So their symptoms are a little different from men. I'll skip this. So which women develop heart diseases? So I'm just going to talk about the most important hormonal factors. I'm just going to briefly guide you because I want you to be aware. Women can develop heart disease at any age. So do not take my statement that the risk increases after menopause as something written in gold. You can have the heart disease at any age. Estrogen is protective. Corollary to that, oral contraceptives which have estrogen actually cause more harm. I'm not going to dwell into the details of that, but I'm just going to tell you. So menopause before the age of 40, risk substantially increases. So regular follow-up after menopause is something that you should be really looking at. Family history, very important, family history. So I hear many people that have a very strong family history of cardiac diseases. My father had a disease, a heart attack. I asked him at what age, he said 85. You're dumbstruck. So actually, the male members of the family, if they have a heart disease before 55 and the female members before 65, actually contribute to a strong genetic family history. Pregnancy. So pregnancy, there are multiple hormonal changes which have effect on your heart. High blood pressure, anemia, gestational diabetes, that is diabetes during pregnancy only, increases the chance of heart diseases. I've spoken on oral contraceptives, PCOD. PCOD, very, very important. I'll just take a minute here because the number of women with PCOD, we do not know why, has increased substantially in today's generation, especially the second and third generation. In PCOD, your hormonal system, the HPA axis, that is the hormones in the body, go for a toss. This itself has an effect on the entire cardiac cycle. So patients with PCOD, I generally tell them to have a cardiac evaluation at least bi-yearly, that is once in 2 years on regular basis. Obesity. 1947, we are a country of famine, and now we are a country of the maximum obese people known. So we've come from nothing to a lot. Okay. Now, very interesting, I'll just touch on a topic here also. Our genetic makeup was done. Indians' genetic makeup was done. They found something called a famine gene. I will not go into the details of that. So it's a famine gene. So what our body does is, when we eat, not like a Western, a white person, but our body will try to conserve the energy. Energy can be conserved only in the form of fat. That amine gene is still in us, but we have become a country of excess. So we eat a nice little burger, which can last us probably a week, but we eat it on a daily basis. So that's why obesity is increasing in our population. Diabetes, we surpassed. We are the number 1 in the world. Cholesterol, HDL versus LDL, I'll speak on. Smoking, I've already spoken on. This is one, I think smoking should have been like the top most. I didn't have something to highlight it out there or something, but smoking is the number 1 killer, especially the cardiac problems. And as I was saying, there are multiple things on the internet which you can go on for women and heart. The AHA has spent $5 billion on research of women in heart, and we still are where we are. So symptoms in general, as I've spoken about, I'll just run through very fast. Pain or chest discomfort, dull, heavy. You will hear a patient say that, that as if there is a stone on the chest. Pain in the neck, throat, radiating to the left arm, nausea, vomiting, unusual fatigue, but do not look much into the unusual fatigue part of it. Shortness of breath, yes. Even if you feel that you were able to walk 200 meters and now you're able to walk only 50, is something that you need to be concerned about. Symptoms in women are a little different. The tightness in the pressure stays the same. They will attribute that to gastritis most of the times. Unusual fatigue is very common in them. Stomach pains, dizziness. Dizziness, yes, it's very important that you look into this because women generally present with dizziness in these conditions. How do we prevent it? Now, I don't even need to say this because as I said, every topic you had, somebody or the other must have told you about good lifestyle, good exercise, but it's never followed, trust me. So know your BP, keep your sugars in check. Quit smoking. Quit smoking, number 1 and the most important. Alcohol, and this I'm not saying this because I'm Parsi and we love alcohol, I don't drink, but limit your alcohol. Alcohol is actually in moderation good for the heart. Okay? Your principal is looking at me with open eyes, so you're not going to look at it. But it is in moderation, 30 ml twice a week, sorry, is good for the heart, but in excess is always trouble. Stress, I've just added that line, is it modifiable? Do you think living in our country, in our city, we would be even able to function without stress? Doesn't look like. So you have to learn ways to actually deal with stress rather than actually get into it. Hypertension is a major factor. 1 in 5 patients of reproductive age group do have hypertension. 56 million individuals, women in US have this. And hypertension in pregnancy can go away after pregnancy is, 42 days after pregnancy, but the chances of you having heart diseases later are still there. Lifestyle modification, quit smoking, again. Eat a healthy diet, lean meats, most important, vegetarian. So whole grain, fruits, vegetables, low fat, fat-free diet, avoid saturated and trans fats, added sugars, and high amounts of salt. Now, this salt, one quick question. There is a very weird study. I will use the terminology weird because it is found that Indians take at least 12 to 20 grams of salt a day in their diet. You will not know that. You put in everything possible. But the American Heart Association has given guidelines of 4 grams per day. You will not be able to eat anything. Trust me. So moderation is the key here. Moderation is the key. Okay? So eat a healthy diet, especially salt is something which is very, very important. Healthy exercises, 30 minutes of moderate exercises, not a stroll, proper moderate exercise. I see people come with me, doctor, I have 10,000 steps on my watch every day. But that's not over 24 hours, I want it in the next half an hour or 1 hour. So you can't split it. You have to do that exercise at that time for 30 minutes at a stretch. That's what actually constitutes a good exercise. Manage stress. Meditation is something that you should be really looking at. It does help in a great way to manage stress. Follow your treatment plan. So somebody is given a medicine for blood pressure. Religiously, since the day I prescribe some medication, they will check their blood pressure thrice a day. Then it becomes normal. The person gets an MBBS degree himself and stops the medicine and forgets to check the blood pressure and comes with a stroke. And I'm not telling you this just as a joke, it actually happens very often. So please do not stop any medication without prior approval of a practitioner. Exercise, as I said, 30 days, start slow, very important. So you'll be hearing about people dying in gyms, okay, day in, day out, because they start vigorous exercises immediately, which is actually wrong. You start slow, let your body get used to that, because exercise eases stress on the heart itself, which is not used to so much. So be very careful of that. Support and education, this is what we are here, and talk to your healthcare professionals, very, very important. Valve disease in women, my topic, I love it. So, as you know, we spoke about the blood supply, what the heart gets. Now, heart has to supply the other organs also. So here is what your deoxygenated, that is your bad blood comes and goes to your lungs here, okay? Then from the lung, you see this aorta? Yeah? You see this left atrium? So oxygenated blood from the lung comes to the left atrium, goes back into the left ventricle and goes back into the aortic valve. Now, heart is a muscle, it pumps. So it has to relax. So to prevent blood from coming back into the heart or going in the reverse direction, there are valves. The most important valve being your mitral valve and your aortic valve. You see this? Aortic and your mitral valve. And when I was doing a fellowship in valve diseases, I was amazed. As our generation is becoming older, our valve diseases are rising at a substantial rate. But the case is not that. Valve diseases were totally underdiagnosed 5 years ago. We always had that disease. So this was something I took from a journal, but I want you to concentrate on why there is a sex-based disparity in valvular heart diseases, most important underrepresentation in research. There are lack of sex-specific criteria. Valvular heart diseases are very common in women and they provide a greater burden of heart diseases. There has been a recent paradigm shift. As the medical fraternity is doing great research, the life expectancy is going up. As the life expectancy goes up, diseases increase. And valve, I will show you in my aortic valve presentation how many times in your lifespan do you think your valve will open and close. So you can imagine the stress of blood and everything going down. So we have now good echo machines and proportion of aortic stenosis has dramatically increased. So this is what I spoke about. The aortic valve, as I said, is from the left ventricle to the aorta, the valve which prevents it from coming back. If your heart beats 72 times per minute, that is your normal heart rate, okay? It may go up to 100 or so. By the time you are 100, it will be 3.7 billion times. It's going to open and close under the stress of blood coming out at 120 millimeters of mercury. Do you know what 120 millimeters of mercury look like? Okay, so when you puncture an artery, and if the pressure is 120, the blood will spurt from here till at least the end of that. So that is the pressure which actually is 120 millimeters of mercury. So what are the symptoms? Angina, that is your chest pain, dizziness, and breathlessness. These are very common, especially in older individuals. And it progresses with age. I'm not going to go into details of that. Diagnosis also not. So this is what actually valve looks like on a 2D echo. I don't know if I can take it in again. But this is a stenotic aortic valve, and that is what it actually looks like on the 2D echo. This is the valve. Having trouble playing it, but you see this thing opening and closing in the center? That's the aortic valve, and this is my patient, the real life patient. Okay. So treatment options were very limited to surgical, say 5 to 7 years ago. But I am here today to tell you something with great perseverance and the innate technology which has, budded to an extent where today we can actually replace valves by opening the chest, which is a brilliant thing. Nobody likes surgery. Nobody likes surgery. And everybody wants to live. Everybody wants to live till 100. I don't know if any person who doesn't want to live. So this procedure is actually done under local anesthesia. Okay. I get the patient in the morning, only local anesthesia, one IV line. The procedure is done. I will show you a live procedure. The procedure which used to take us 3 hours now takes us 30 minutes. And what hospitals say was 3 to 5 days previously, we discharge the patient in 24 hours home. So that is how technology has advanced to that level. So this is what actually it looks like. I'm going to guide you through it. So this is actually an animation where you actually go through your femoral artery. That's the artery in the groin. Okay. This sheath is just placed. We just come out with the sheath. And that's your, if you remember the heart, what I said, that was your aortic valve. Here. This is your aortic valve. Now, the interesting part. I place the heart to a level where heart comes to a standstill. The heart cannot beat. When I open the balloon, so this is that balloon which opens. It cracks the valve open. It cracks your native valve open. I then decrease the pacemaker, get it back, remove the balloon, remove that sheath, then pass a valve which is already sheathed. And what all you're seeing is 4 millimeters. I am working in millimeters here. Okay? That's the beauty. So then I open it and the valve just opens in position, and lo and behold, we have a new valve without even doing anything. Though it sounds... No, I didn't make this device. I just do it. So, I'll just go ahead, and this is what your new valve actually looks like. So this was my first TAVI, very close to my heart, very, very close to my heart. And this was an 85-year-old woman surgical cut down, and somebody from the audience was also involved with this patient. So she came, surgical cut down. She's actually a resident of Kuwait where everybody refused surgery. Everybody refused surgery. I said, it's my first, let's do it. Nothing to lose. So this is what the valve actually looks like after placing it inside. And slowly opening the valve. And this is what the final result is. This is what actually the valve looks like inside your body. Okay. And I had to post-dilate it. Post-dilate means I have to make the valve a little bigger so that there is no leak. And the final result you will see 0 gradient, 0 PBL, and the patient went home in 24 hours. So that is how important, how science and technology has changed, And this case looks very easy. It was complete nightmare. It was riddled with all the complications you can even think of, which I'm not showing you for my personal case. Okay, now the mitral valve. So you generally hear patients, I have 3 more minutes, but I'll just take 5. So when a patient comes with heart attack, the pumping of the heart goes down. The heart enlarges. The valve has a certain area. So when the heart enlarges, the valve cannot, contribute that. There is backflow of blood. So many individuals who come late with heart attacks have something called mitral regurgitation. So the mitral valve starts leaking. 1 year ago, if somebody came to me, I would have put them on medical management. But now we have something called a mitral clip. You know the hair clip? Hair clip? It's as simple as that. I just go inside, place that clip, close the valve, so that the regurgitation means the backflow of blood is less. So this was also an actual case. This is what the heart actually looks like on a 3D echo. Okay? I don't think you will appreciate, but that's what the mitral valve actually looks like on a 3D echo. This is a real patient, no animation. So you see that there is a lot of leak. I appreciate that. You see that backflow of blood which is coming back? Yeah? So that is severe mitral regurgitation. That is. So what we did is, we went inside. Now, listen to this. Just listen to this. Mitral valve is on the left side. I can't go through the left side because there's an aortic valve which doesn't allow me to go. So I have to go through the right side, through the vein, puncture the atrium of the heart. That is one layer of the heart I have to puncture. Go to the left side and retrogradely go and put the valve. So that is what you're seeing, me crossing over to the left side, crossing the mitral valve, and that is what the clip looks like. You see this clip? That's what the clip looks like. And that is after I adjust the clip. And the final result, I'll show you the final result because that is what will be left in your heart. This is the 3D final which shows no leak, nothing much, but that is what your heart will look like. That's the only thing which will be left in your heart is this. Okay. That's it. The patient has never come back for any cause of breathlessness or any heart issues. I probably saved him from a cardiac transplant also. So conclusions, heart diseases are very significant in women. Do not neglect it under any circumstances. Now it's up to you to raise awareness, empower women, prioritize their health, most important, because the cardiologist may be closer than they appear most of the times, and never give up. Thank you so much. Is that statins only decrease cholesterol, which is wrong. There is something called a pleiotropic effect. So why does this blockage occur, the 100% blockage occur? Because there is inflammation which goes on, which ruptures the plaque and causes that block. Statins have a pleiotropic effect of decreasing even inflammation. So that is very important. So if you have a heart issue, called evolocumab, which is coming, which is injectable once a month, and they bring down your LDL to single digits. So they are going to really, and I didn't mention it, but they are still in research. One injection is 34,000 as of today, but which is going to come down to 3,000 rupees, which is actually going to be as equal to.
Should have a defibrillator there,
Yes.
and a training on CPR.
Yes. Yes. So I'm a ACLS trainer for AHA, American Heart Association, and it is said that any gathering of more than 15 individuals should have an AED, because defibrillation is a beautiful device. You should know chest compression, but once you attach the pad of the AED will give you prompts on how to give the chest compression and when to give a shock also. It's just one button. There's one orange button on it. The device will say, all clear, shock advised. You just press shock, it will be delivered. So AEDs are absolutely essential in gatherings, especially like we have here. But you have a cardiologist.
Any more questions? Please raise your hand.
Hello sir, good afternoon. Sir, I wanted to know, many times we get confused with an acid attack and an heart attack. So is there if you can throw light on that?
So I would say, do not neglect your symptoms. Do not neglect your symptoms. In today's age and time, I cannot even say that you are probably 20 years old and you don't need to worry about a heart problem. No, in today's generation, that is something which is not true. So if the symptoms occur, especially while walking, you have this heaviness, even if it's the epigastric, that is the stomach region, I think we should get that evaluated. Then that's what.
And what kind of tests would we do for that?
I would still bank on clinical examination rather than doing any tests, sir. Because even though we have a multitude of investigations at my back end, what I hear cannot be replaced by any test. Most important. So then that becomes the first point. If I feel that this absolutely doesn't look like a cardiac issue, why would I evaluate the patient any further? Because that increases the stress, the financial burden, and other factors which I can't speak about out for me.
Alright, so I'm just going to extrapolate the same question. What according to you and when, at what age would you say that a lady needs to go for screening and for a cardiac disease? And when I say screening, what exactly does she need to do? How does she look after her heart?
So ma'am, the youngest angioplasty on a woman I've done was 19 years of age. 19. Okay, that was 1.5 years ago. She doing very well, but she had genetic risk factors. So as I said, no age is a complete, contraindication to come to a cardiologist. When you feel that you have any symptoms which are out of the ordinary, see, since acidity, what you're talking about, you've been experiencing that since childhood. You will know when something is off. That is the time that we actually have to put our foot down and say, yes, we need to get evaluated in some form.
Many times I have observed that the young boys especially, they stop smoking, but they are going for the tablet and they say it's safe. Your comment please.
So, the cigarettes. So, we were taught in this way. I don't smoke. Just to clarify. Cigars are the safest because they have 2 filters. Then comes cigarettes, then comes the BDs which we have which do not contain filters. So it is not only the nicotine which causes heart issues. It is the additives also which contribute. So you are choosing better of the 2 evils. Nicotine is also bad because I have actually seen, I'll give you an example. 24-year-old came to me in the middle of the night at heart with severe chest pain. ECG suggestive of acute heart attack, acute anterior wall MI. I thought something was wrong because when I did an echo, it was, when I did the echo was absolutely normal. So I did an angio, whatever was it was, because he's a 24-year-old, bang random. So nicotine actually caused the spasm of the vessels and gave me that symptom. So you're just choosing the better of the 2 evils. Hello, sir.
After listening to your talk, can we make a lot of cardioneurologists? Any pain anywhere, run to cardiologist.
That just adds to my bank account, but that's okay. No, so cardiology per se, whatever time is of the essence there, and my contention to give these talks are, time is muscle. If you're having an heart attack and you are mistaking it for something else, you come to me after 48 hours, I will not be able to save the myocardium. So I'll give you another example. The patient is with me, so I can tell you now. 42-year-old gentleman presented to me 48 hours late, same symptoms, gastric pain. But this happens only while he's playing football. Comes to me in the evening, in my OPD, walks in with frank anterior wall MI, bad ECG, showing that the heart attack has happened probably 12 to 8 hours ago. I did an angiography. I don't have it to show you. But the main artery of the heart was 100% occluded. His pumping had gone down to 20%. 20% from a normal 60%. He had such a stormy course. He was on a ventilator. He's on a ventilator since the past 5 days. Luckily, I managed to put an impella, which is an artificial heart. Or he wouldn't have survived for the simple reason, for 24 hours, his heart had come to a standstill. So it was the impella doing the job for the heart. But I'm happy to tell you that today I'm going to remove the impella because he's awake, conscious, and he's going to go home. But it's not an everyday thing. It's not an everyday thing. This was my luck. This was his age. Probably if you were 65, you wouldn't have survived. So that's very important. Having said that, Imbella is 30 lakhs.
Sir, how accurate ECG tests are, and there can be a thing like some patients or some people will have abnormal ECGs only.
ECGs are more of a rule-out test, sir. So if you have, so always have a baseline ECG. So at 30, always take a baseline ECG. What it is? Because some individuals, including my own father, has something called right bundle branch block, which is since birth. Now, new onset bundle branch block is a red flag. But if you have it since birth, it's not no problem. So always it is a comparison of an old ECG to a new one to take it further. More of a rule-out test rather than a rule-in test.
So can you just let us know what is the difference between a stent and the TAVI which you do and cost implications?
Oh.
Percentage-wise is okay.
Okay. So what stents I put are 3 millimeters. Okay, 3 millimeters. Whatever you saw, I will tell you. So that is 3 millimeters. The TAVI valve is 28 millimeters. But that 28 millimeters I crimp into 3 millimeters to pass through here. So it is made of a special material called nitinol, which is a self-expanding. So when you warm it, it expands and stays there. When you cool it, it can contract. So that is the difference. Now comes the cost implication. Should I? Okay. So a stent, a 3 millimeter stent which you put in the heart is capped at 38,000 rupees. TAVI valves are Indian and foreign. So the Indian valve is 19.5 lakhs and the foreign valve goes up to 27 to 30 lakhs. Yes. I was just going to come to that we took special permission for this insurance, sir. We had to actually write to the IRDAI. We were 11 cardiologists who, through multicentric data analysis, wrote to the IRDAI to keep TAVI as a procedure which can be reimbursed.
Hello, sir. Sir,
Okay.
I was very fascinated by the gene that you were talking about. That is the gene that is found in Indians.
Okay. Family gene.
Yes.
So, it was done in a genetic study to find why obesity is on the rise in individuals of our country. Okay? And we found that there was you are a nursing staff, medical student, so I can go into a little sheet. Lovely. Done. So, the T component on genome 32 is replaced by A in Asian individuals. Okay, that causes an increase in the Krebs cycle which occur in your body, which causes fat deposition in the peripheries. That is just for conserving energy. So that was something found more in South Asian individuals, especially in Indians and Sri Lankans and people from South Africa. So yeah, it was very interesting to me also. I read that in detail.
Thank you so much, sir, for patiently answering all the queries.